We are here today because we are under UNAC UHCP, and we're fighting at many local tables and tables throughout all of California and Hawaii, trying to get a fair contract. And this contract is not about money. This is about patient care. It's about having proper staffing to meet patient care needs. It's about taking care of our community, and also about protecting our professions and our integrity. We want to provide ethical, equitable service to all of our Kaiser members, and we want to provide that and deliver that care in a reasonable amount of time. We don't want our patients waiting months for an appointment. We want to see them when they need to be seen. We want to provide the good quality care they've come to expect from Kaiser Permanente, and we want to be able to do that in a way that we don't have this moral injury that we're not providing the right care and be burned out by the end of the day. We need sustainable health care for the future. So I am a physical therapist, and I have been a physical therapist for 25 years. And in 20 of those years, I've specialized in pediatric care. And right now what we are facing with our pediatric population is that we're so understaffed that our children that need care, that are our most vulnerable patients, that have the quietest voice, they're not receiving the care they need in a reasonable amount of time. And they can't even get in to see us except maybe once a month, maybe once every 2 months. That's not quality care, and that's not the amount of time they need to be seen. That's not the frequency of care they need. We had a strike back in October, and it was a 5-day strike, and we were fighting for a good contract then. And then in November of 2025, Kaiser walked away from the bargaining table and wouldn't bargain with us anymore. So we've come back to the strike line, not about money, but to get Kaiser just to come to the table to negotiate with us. You know, everybody here would rather be at work. Everybody here would rather be seeing their patients. But if we don't do something to stand up to Kaiser, we still can't take care of our patients because we can't get them in. We don't have enough staffing to meet their needs. So we're asking for reasonable workloads, because if we have protected workloads, then they have to hire more staff. We're trying to fight for the ability to use our PTO time. What good is PTO if you can't take it? If you can't take that time to rest and repair, how can you have the strength, the energy, and the mental acuity to be able to take care of your patients? We're just withholding our labor so Kaiser can feel the depth of what we bring and the impact of how important we are to caring for our patients. Caring for our patients is not about numbers. It's about quality care. And we want them to understand we are valuable, we are licensed, we are professionals. We're not easy to replace. Take care of us so we can take care of our patients.